Okay, here we go. So I haven't biased you with any information, right?
Correct.
I want to move this a little bit. Okay, so tell me how you felt after last time.
Yeah, I was sore.
Sore where?
Through my, like, I would say more my leg, and I think some of it was this. Because I have not done.
Okay.
Yeah, from our last session.
Yes.
I felt sore.
So after last time, we did a lot of neural dynamics, and then we followed it with the strengthening, which is what we're supposed to do.
Yep.
So did you feel more your nerve pain sore, or did you feel more muscle sore?
Muscle sore.
Okay.
Yes.
Very good. And what did you think?
I did feel that so that was Monday.
Yep.
Tuesday was a non-typical Tuesday, so it was a light work day. And then Wednesday, Thursday was a typical hard day. And I felt pretty good last week.
Good.
Yeah.
Very good. And
this week I've been pretty good too.
Awesome.
Yes.
And pretty good by less leg stuff, back stuff.
Thinking back, I had some isolated pain.
Mm-hmm.
But I felt that anything leg related resolved faster
Good.
than the past.
Good.
Does that make sense?
Yes. Yeah, so the two wins would be intensity and frequency.
Yes.
Right? So if one of those increases or improves, then that's great.
Yes. So I'm a data collector because I need to see it. And I have the checkbox. So I have on my to-do list to make a exercise form to check off when I'm doing it.
Yeah.
And
okay.
also to, like, how was my work day, or like,
yes.
what did I have going on? Like, I know I have to clean out the garage this weekend.
Yep.
So I know that's going to cause some discomfort.
Okay.
So I just want to see, like, what's the difference in doing this and not having done it.
Yeah.
So,
I think it's good.
Obviously share that with you, but
yeah, I think it's good to treat it as a science experiment. That's what we're doing. So
yes.
I want to check the range of motion again and the quality, and then if all is feeling good, then we progress.
Okay.
Right? And so just to confirm, kick the left leg out. What do you feel there?
It's just a tight.
Just tight?
Yeah.
Your familiar stuff?
Yes.
Okay. And then the right?
Totally familiar.
Right leg? No problem. Okay. So I want to measure the left again. Okay. And you just stop when you feel stuff. Hang on, let me get this. Yeah. Yep. When you feel the onset. Right there? Mm-hmm. Okay. And mild, moderate?
That's mild.
Mild. In your similar area?
Yes. All right here.
Good. So that is 10, 20, 30, 40, 50 degrees, which is better than what we started last time.
Okay.
I just looked at the last video and it was 45 when we started. So a little bit of improvement I would expect.
Okay.
And so what we do from here is, I know you're doing your home stuff, which is great. That's why you've had this improvement. And we're going to progress the range of motion with the nerve glides and see where you're at.
Okay.
And to see what we need to adjust dosage-wise, if we need to go higher in the range or do more reps, just so we can match how your body is presenting today with the improvement.
Okay.
Sound good?
Yes.
All right. It's your head down here. Yep. So we're going to move into this. Okay. Otherwise, how's the back been? Like this mid to low back?
Maybe check on me after my next several patients I have.
Yes. So you're seeing clients today?
Yes.
Okay.
I go until 3 today.
Okay. What do you feel there?
I feel tension,
Your
but not actually in my calf.
In your calf, okay.
Mm-hmm.
I'm going to bring you up again. Just tell me when to stop. There. And so this is the straight leg raise test, which is for nerve involvement related to your back. And so you're kind of out of that range of like a conclusive test, but it's still there. So what do you feel there?
Tension.
Tension in the calf or in your stuff?
From knee to my hip.
The back, in the back? Okay. And then does it better when I do that?
Oh, yeah.
Okay. So when I change the angle here, this is tension in your nerve. It's not a calf stretch.
Right.
Right? Because the only thing that changes is your hip range of motion when I bring you down here, and you don't have it now, I'm assuming.
Correct.
Okay. So it's only when I bring it up.
Correct.
So the only change that happens in your hip, and that's called neurodynamics, which means that you're tugging on that sciatic nerve. So you're higher into the range today, which means I'm going to be more aggressive with the treatment.
Okay.
And since you only had muscle soreness after last time, it tells me that I can give your nerve a little bit more.
Okay.
Which is great, right? We can progress a little faster here.
Okay.
If you were somebody that was a little bit more irritable in your symptoms, then we would just progress slower.
Okay.
And by irritable, I mean just more intense, or you had it more frequent, or when you did have it, it didn't cool down and recover quickly.
Okay.
What do you feel now?
It feels good.
Feel good?
Yeah.
So I'll do about 20, 30 reps here,
Okay.
and then we'll increase the range of motion as we go. So have you been doing the squats?
I have.
Good.
Yes.
Good. I could tell last time you were a little fatigued.
Yes.
And that's okay, but it's a package deal, right? So we improve your nervous system, but then we also improve your entire system around that nerve to make you more resilient. Sound good?
Yes.
I'm going to go a little higher up this time. Just stay nice and relaxed for me. There we go. What do you feel there?
Tension behind my knee.
Behind the knee?
As high, yeah.
Okay. Very good. That's very, very normal. Anything back here? Mm-mm. Awesome. Now, when you do the nerve glides on your own, does it feel like this?
Yes.
Good. That's great to hear.
I would say it's getting more intense.
Behind the knee? Mm-hmm. Okay. I did apply a little more pressure here, and so I would expect that a little bit of intensity at first, but it should calm down. Doing okay?
Yeah.
I love it. So that just slackens the nerve, gives it some relaxation. I'm going to go a little higher up. Big stretch here, right?
Yep.
I'm going quick on you today because last time you did just fine. Yeah, that's okay. So I'm going to take you up. I can't see your face, so you feel a big stretch?
I feel a stretch, yes.
Yeah. Now, what I think is really neat is that when you don't include the big toe, it feels different than when you do include the big toe.
Oh, yeah. Oh, yeah.
Right? And it's so interesting because that nerve comes down and it branches to so many parts in your bottom of your foot that if you don't include the it's wild. And I think this was the toe we found that was a little stiff too, right? Yeah, that's a little stiffer than I would have expected, but that's okay. Do you all right?
Mm-hmm. I feel it.
Any symptoms right now?
A lot of. I feel like tension's the best thing right here.
Okay. Yep. Anything further up though? Mm-hmm. Great. So since with this elbow down here, I'm forcing that knee straight.
Okay.
And so I would expect you maybe to feel a little bit of stuff behind your knee.
Yes.
But anywhere else, much higher than last time, which is really, really cool to see. And what's really neat, in some people who have really intense leg pain, we treat the other side first.
Oh, to show the difference?
To help reduce the sensitivity of it. Because some people have what's called a cross straight leg raise. And so if they have a really, really bad nerve involvement on the left side, when you lift the right side, they'll feel it. It's really interesting. How you doing?
Good.
Feeling good?
Yeah.
All right, so I'm going to bring the whole leg up. Tell me when. Ooh, yeah, okay. I can feel a little resistance. This is like level 3 treatment here.
And how many levels are we?
I usually make up as many levels as I need to.
Okay. Makes sense.
Yeah, because I just always increase the intensity. There's a bajillion ways to do it. But for you, I want to stick in this straight plane, but go a little bit further into it. The next step will be bringing this leg over your body.
Okay.
And we're just not there yet, and that's okay. Doing okay? But when you treat the nerve, it's like a light switch, so it's completely on, then completely off.
Yes.
Completely off, completely on.
Yeah, it doesn't have to go all the way down to be off.
Yep, that's exactly right. Yeah, inches of movement makes a huge difference.
So remind me again why I can't find comfort on the floor, because that's muscle and not nerve.
Comfort in the leg part?
Or even, it's typically leg and hip.
So, two different things. So with the leg, when you're on the floor, your back's typically in lumbar flexion, so you're in a little bit rounded. And when you're in a little bit of rounded position, that increases the tension in the nerve. Okay, so in this position, you're fairly straight and neutral, so we haven't got to the rounded part yet.
Okay.
But that's why we're doing the mobility work, such as the cat camels and improving the lumbar flexion, because we need to treat the entire pathway. And I'm starting more distally or further away in the leg because that's where you're more intense.
Okay.
But we'll move our way up.
Okay.
Mm-hmm.
But this week I did try, I don't know if you saw in my office, there's like a brown, in the corner is a chair that I can manipulate the size.
Okay.
I don't love the chair. I need somebody to look at it because it slides. But I have been putting more clients in that just because I have to save what I can from being on the floor. Because it's definitely, work related. On the floor is where I feel the exacerbation.
Yeah, that's the hardest part. I mean, the floor is a hard surface. You're in lumbar flexion. You're doing a lot of reaching, and everything is kind of forward. So that's the hardest thing when you have a flexion of the lumbar spine. It kind of opens things up, but then also it kind of puts a little bit of pressure into the area because the disc material moves posteriorly or backwards when you're in flexion. So that's what I would expect.
Okay.
How are you feeling right now? Good?
Yeah.
Let's retest.
All right.
I'll sit on up. I went more aggressive this time.
Yes.
Which I think is fine. Okay, and then you just kick that leg out straight and see how it feels. What do you feel?
Oh.
What do you feel? Yeah, what do you feel?
I mean, there's a little bit of tension there.
Okay.
But then the higher I go, it almost releases.
Okay, awesome. Yeah, big improvement. We're talking 20 degrees or so.
Yeah.
Which is good, which just tells me that you're ready to bump it up on your own.
Okay.
Okay?
Now, let me have a question.
Yeah.
When I am doing my own, should I now keep my knee? Because I was having loose, softer leg when I was doing it. Should I try and lock my knee?
I think we're now ready for that.
Oh, okay. Yeah. So that's what you're saying. Okay.
Because that's what I focused on today because it just tensions it more. So that's what we'll review right now.
Okay.
Oh, strap. All right, on your back. All right. Very good. All right, so let's see it on your own. Now, you could feel really loose right now, right?
Oh, yeah. I'm super loose right now.
Okay, so that's exactly right. So on and off.
Now, I'm keeping myself locked. Do you want me to go loose?
You can lock it now.
Okay.
Yeah, you can lock it now. Now, if it really just hits here.
Yes, I'm feeling.
You feel in other places?
My calf a little bit.
Okay. It's okay in the calf then.
Okay.
And so you're just going to pull back now on and off. There you go. That's it. Right? And this is good for during the day too. If you're with those kiddos and that leg stuff is bothering you, then you can come in here and loosen it up.
Okay.
And those nerve related symptoms. Good. Perfect. Better than last time.
Yeah, it feels good.
Good. Same dosage before too, right? Couple sets of 28 or 30.
Yep.
Just at that end range. You don't have to go all the way down. Just at that end range where you feel it.
Little pumps.
The little pumps at end range. Okay. Now, have you been doing both sides?
No.
No? Okay. It's completely up to you if you want to do both sides or not. Like, if you have the time, go for it. If you're
like within my practice, once I was weak, we would do double. Like if I'm doing chewing or something in the sides week, I would do 1, 2, 2, 1. But I don't do that the whole body, do I?
So here's the thing, like when you start feeling super loose and good on that side, you really want the other side to feel like that too.
True.
Right? And so it's really your call.
Okay.
Specifically, if we're focusing on the left side, I do the left side first.
Okay.
But then if we're like, hey, we're trying to round you out and get you more resilient, and once we start doing more strengthening, then I have you do it on both.
Okay.
But then I start including some mobility exercises that do both at the same time, the nerve glides.
Okay.
Because this is the hardest part right now.
Okay.
Right? And so really don't have to worry about it, but if you want the right side to start feeling like the left in regards to how the nerve feels, then you can.
Okay.
But if the right side's not bothering you, it's up to you.
Gotcha.
Very specific treatment. Now, like the squats and other things, those are global treatments, and so those are what we focus on.
Okay.
Okay, so let's work into the improving the lumbar mobility then.
Yes.
And so I've given you what for that? You remember?
I have like 5 exercises.
Yes. The open book, yep.
I have the clam.
Yeah, the strengthening.
I have the lifting. The
strengthening.
Squats.
Yep. So
I'm
you're
missing one more.
Was it the rocking the knee side to side? Uh-oh. I clicked something on. Oh yeah, the trunk rotation. Okay, so now I want to improve that flexion, right? That you're talking about, that sitting on the ground, that flexion moment. And the trunk rotation does good to loosen things up, but let's work specifically into the flexion. So let's go hands and knees. We're going to do what's called the cat-cow or cat-camel. You can do it on the table.
Yeah.
So this is where the lumbar flexion moment comes in. So when you try to arch your back,
Yes.
right? So you're going to go head up and butt out. Yep. Any problem there? Mm-hmm. Okay, and then the other way for me. So really head down and round things out. Anything there?
Yep.
Great. And I wouldn't expect you to, because right now, since your legs are bent,
yes.
your nerve is on slack.
Yes.
Right? And so this is just improving the proximal area, so the lumbar spine, where prior to this, we were doing the distal area or the leg where the nerve is. So let's do 20 of those, and we'll go from there. So with the mobility exercises, just like the nerve glide, a little bit more is better. This is not strengthening. It's not going to create a muscle burn. It's just loosening things up. It looks good, right? You look good position here. Good position, the knees underneath hips. You're doing awesome. Really, really good. How's this feeling? It's a go-to exercise. I do a lot of yoga maneuvers, right, for mobility of the spine. I think yoga does a really, really good job at doing that. And so you see a lot of that in my practice. And so very good. Now what I'm going to have you do is you're just going to spread your knees a little bit more. And now you're going to sit your butt down towards your heels until you feel a little stretch in your lower back. And try to relax the head down. There you go. Anything there?
No, but I will do this stretch every so often.
Good.
And then I do the, I don't know why I always feel like I need a rock.
That's absolutely.
It's the mom in me. I don't know.
No, that's absolutely good. You're biasing side to side, and your body kind of tells you what it's looking for.
Yes.
So bring the hands up further. Good. Head down, and then you just want to relax into it. Breathe out. Relax your body into that, and then you'll come back up to the hands and knees position. Yep, and you'll do that a couple more times. Breathe out. Good. And we'll do about 3 more just like that. Feeling good? Mm-hmm. These are always the feel-good things, right?
Yes.
Never ever make anybody worse. Okay, so let's stand up and let's just check your full lumbar range of motion. You can do that bending forward and see how you feel. Come back up.
I'm tight here.
Tight where?
Yeah. Like I feel like I could do this.
Oh,
here.
okay.
It's like,
Yeah.
there we go.
Yeah. Do you feel anything in the leg or just the back?
Just the back of the leg. Just the tightness here.
Yep, that's fine. You still have a little bit of that tension, but how'd that range feel compared to before? Do you feel like you could typically do that?
Yes.
Okay.
Yeah, that feels good.
That's good.
Yeah.
Okay, awesome. Overall feeling good right now?
I do, yeah.
All right, so now we've loosened things up at the spine and distally in the leg, and now we followed up with the strengthening. And so that's your bridging, and that's your clamshells, and then that's your squat.
Okay.
Right, and we're going to introduce a little bit more today, too.
Okay.
Sound good?
Yes.
All right, so on your back, let's do the set of the bridges. And I think what some people miss sometimes is that when you're improving leg symptoms or radicular symptoms, right, you can keep going, but you have a little bit of weakness in the leg and the symptoms down the leg. You've got to improve the nerve, the health of the nerve, before you improve the system. And so this is the system approach where we're improving your back strength, your hip strength, your overall tolerance to activity, just your general strength. But you've got to do that at a time where your nerve symptoms are feeling pretty good.
Yes.
To maintain that.
But wouldn't I just aggravate my nerve if I was...
I would think that in your case, you just wouldn't have any improvement.
Yeah.
Some people who have really hot nerves, so like they can't do very much before they have leg pain or do anything at all, and they go to strengthen, they're missing a part of it, and they think that the strengthening is making them worse. Yeah. But in fact, like they're just not ready for it yet.
Yeah. The foundation is not there.
Mm-hmm. But what I love about treating this is that you have improvement so quickly.
Yeah.
Which is really, really neat to see. But the key is dosage, right? You've got to do quite a bit on your own as well, because we only see each other once a week.
Right.
Right? Which is fine. It's completely appropriate for you, but it just means some of the effort's on your end.
Yes.
It looks really, really good. So we're going to do the bridging, we're going to do the clamshells, we're going to do the squat, and then we're going to finish it off with a new exercise.
Why am I forgetting the clamshell?
That's the one laying on your side and lifting the leg up.
That's right.
Yep. Now before, it's just your body weight, right?
Yes.
Okay. Or the weight of your leg. I'm going to bump you up a little bit today, right? So the glutes is the area where the nerve comes out of, right? It kind of comes next to the piriformis muscle. So we're going to spread the leg apart. Yep. Up, 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 and down. You're going to feel good. You're going to feel a good burn here.
Yeah. Right in here.
Yes. Yeah. That's that muscle that we're shooting for. Lift again.
And that's what hurt. That's the area of pain often. Yes.
Do you feel discomfort with this or muscle work?
I mean, I wouldn't stop.
Keep going.
But it's not to a point of, like, I can't do it.
Yeah. Muscle burn, like the squats did? Or does it feel different than that?
It's almost makes me think of the isolated pain I have when I'm in pain.
Okay. Let's keep going here.
Yeah. When I go up.
Okay.
If I go down, I'm okay.
Okay. The contraction of it. Yeah. Up, 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 and back down. Right, with your back discomfort, it's very much mechanical, non-specific back pain. And so we know the progressive strengthening is really good, but the package to get there is different for everybody.
Okay.
And we're just encouraging some movement. But it felt good with the bridges. You didn't feel?
Yeah, I didn't feel.
Yeah, which makes me think it's probably just a little more butt muscle. Go, 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 go. Okay. Now, it's not helpful that I'm pushing them down a little bit, right? It makes it a little more challenging. But I just want to get a little bit more strength out of there right now.
So is that where I would use like a band between
Exactly.
them? Okay.
Yep. But I don't know if we're going to add that today or not, just depending on how you respond here.
Because there was a band in the video with the squats.
There is, yes.
And I didn't know if that was something we would get to or if that's just...
We'll get to that. And in the program I use for the exercises I give you, it's not 100% accurate.
Yeah.
Because there's some variability.
Well, they are helpful, though.
Oh, yeah. They ring a bell,
written
right?
directions and a video, I think, is...
Good.
It's all the
right.
learning mechanisms.
Other way. Now, I bet this is going to feel different.
Okay. Yeah, there's
Nothing?
nothing.
Good. So interesting, right? The nerve stuff on this side and the back.
But it has always been my right side since the car accident. I mean, it's never changed.
Got it.
I think that's the biggest, I don't know, concerning if it changed. I don't know.
Yeah. Go, 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 go.
I changed the date on my calendar.
Oh, yeah.
Tuesday the 24th.
Okay, last one here. Very good. Feel that?
Yeah.
Good muscle burn, right? Which feels
Most
good, like
definitely.
you're doing some work, right?
Yes.
Okay, so then we're going to do squats now.
Okay. Do you want me to get a little chair or just...
No, we can do the air squats. It's fine. Show me. I just want to see your form.
Everything.
Don't worry about the cracking. That's very normal. Okay, so
Am I going too far over?
no, there's some biomechanically speaking. There's some things I just want to address here. So you want to make sure your legs are spread out a little bit more.
Okay.
And when you squat down, you're coming into this range. I want you to sit your butt back. And if you really think
I
of
think
it,
when I have the target of the seat
it helps.
is what
It does. You're not going to fall backwards.
No.
And you want to, if you just think about keeping the weight of your body towards your heels, it'll fix everything. Keep the weight of your body towards your heels. There you go.
Okay.
Yep.
Did you really think about that?
Yes.
Looks like you're sitting on a toilet.
Exactly, right? You're sitting back and down a little bit more. Now, that was a really good rep. That looked really good. And you do have a little, keep going. You do have a little bit of, a little bit of arch collapse and like this in the medial knee, but we only do focus on one thing at a time. So let's just get the form down. And so you don't have to overload your brain with all of this stuff.
Right.
Now you should feel this into your quads and your legs.
It's not hurting though.
No, muscle.
Yeah.
I know the squat is a very foundational movement. The reason why I love it is because it works so many things at once.
Yes.
And it's bilateral, so you can get both sides at the same time. Now the goal will be doing unilateral activities, but again, we're just a couple sessions in here, right? So I'm not going to throw the kitchen sink at you. This looks really good.
Okay.
I know. Keep going.
Okay.
I know it's a little uncomfortable, right? You're feeling that muscle work,
Yes.
which is good.
I'm feeling it here too.
Yeah. The quads are a big activator here. Your depth looks really good. Like how far you're going down looks really good. Okay, 2 more.
My grinding knees.
Yeah, a little crepitus there. No big deal. Okay, so how are you feeling overall right now? Compared to when we started?
I feel burning.
Muscle.
But, I mean, I don't.
Okay, yeah, so soreness versus pain is a big thing.
Oh,
Like we would expect muscle soreness. What we don't want is your pain to be flared.
Right, no, that's definitely not happening.
Perfect. So we're noticing that you can go further in your range, your nerves are becoming less sensitive, and you're able to do more and feel better doing it. And so we're going to keep moving forward.
Okay.
Sound good?